Welcome to this edition of EC3 HOSA Medical Moments. I'm Gina Ryan, Director of Hardin County Educational Community Television. Today we're doing a production that's going to kind of show through these winter days that we have. And Melissa Phillips is here with us from the Lincoln Trail District Health Department. And Melissa, we said today, I wanted to talk about all of our services. People may not be aware, of course, that also includes a large number of counties and the population in those counties. So for those that do not have an awareness, and also to refresh my memory, tell us a little bit about the locations and the services.
So we do cover a fairly large geographic area, over 230,000 citizens, because it's 6 counties, and I always have to do them in alphabetical order. It's Hardin, LaRue, Marion, Meade, Nelson, and Washington. So kind of central Kentucky there. Mm-hmm. And our services kind of break into 3 different categories. We have our clinical services, which is what most people are familiar with. Then we have our environmental services, and then we have our outreach services. So I just wanted to talk a minute about what each of those entails.
Okay.
So our clinics are pretty much back to normal operations after COVID. We did have to suspend a lot of things during the pandemic, so we're back to normal activity. And we can do things like childhood vaccinations, WIC, which is the Women, Infant, and Children's Nutritional Program.
Can you define that a little bit in regards to who's available? I know it's women and children, so what kind of services with WIC?
So WIC is a supplemental nutrition program. So part of it's financial need, and part of it is nutritional need. So they do an assessment, but if you qualify for Medicaid or food stamps, you're going to automatically qualify for the WIC program. So you get formula for babies, you get fresh food and vegetables, milk, things like that, just to give families that are struggling a little bit financially some good, healthy foods in the home.
And that doesn't interfere with what they get with food stamps, correct?
No, it does not. 2 totally different programs.
Okay, great.
And it is a federal program.
All right. And when can someone, if they are expecting their first child, is that a possibility?
So mom can sign up when she's pregnant and participate through her pregnancy, can register the baby when they're born, and it goes up to age 5.
Okay, great.
So gets them into school. We do a part of that is we have lactation consultants. So if it is a new mom having trouble breastfeeding but really wants to pursue that, we do have a couple of certified lactation consultants. We do STD testing and treatment in our clinics.
And those are everything here is totally anonymous.
Correct. Mm-hmm. And depending on the service, some services anybody can access, and some services like WIC are income-based. Mm-hmm. Part of our STD testing and treatment, we do HIV and Hep C testing. We can do TB skin tests and disease treatment if TB is found. Something new that's coming back, we've done this in the past, we'll be offering prenatal vitamins to our new moms. And another new thing is we have harm reduction kits available. So we can't give out syringes in the counties that don't have a syringe service program, but we can give some of the other things. Condoms, and some of the other supplies. So if people choose to use, they're doing it in a safe manner.
Great.
And then kind of segueing into the environmental services, this one's kind of behind the scenes, and you hope it's working well, because this is your permitting of your food establishments. We also permit swimming pools, tattoo parlors. We do food service inspections, so if you've ever seen that little poster on the front of the restaurant and you look at that score, that means one of our environmentalists has been there.
Now, how often are those done? Are they monthly?
They have to do twice a year.
Okay.
They
That's
can
a lot of places.
It really is. They can do more than that, but at a minimum, they're going to go in twice a year.
So is it a certain size in terms of the restaurant, cafes, any
They
place
do
that serves
everything,
food?
any place that serves food, all the way from school cafeterias on up to restaurant buffets. So any place that's cooking and serving food, our environmentalists have been in to inspect and make sure it's safe.
And that probably includes like those private entities, such as like a Knights of Columbus hall, or those halls that have catering services that come in or that they serve, like bingo parlors and things?
Catering's a little bit different. They have to get a permit to be able to do that. And so that's something that they are in charge of too. Anytime we have like a fair and we have all the food trucks out there, all of that has to be inspected. So big events like Glendale Days, they were really busy with all the food service going on that day.
And what's the purpose of that in terms of the inspection? What are the look-fors?
They're looking for cleanliness, making sure hot food is kept hot, cold food is kept cold, anything that could lead to a foodborne illness.
I'm going to say I've seen Gordon Ramsay shows on some places that he goes in, and it would raise the hair.
Yeah, pretty nasty.
Yes, definitely. And sometimes businesses are shut down for that type of thing too, correct?
They do. If they have what we would call a critical violation, they sometimes do have to shut them down and give them time to make some changes. And if they can't, then they can't reopen. So,
Right, which is, again, it goes back to the consumer. We want to make sure everyone that walks in the door gets out healthy.
and that's one of those things, you know your health department is working when you can safely go into a restaurant without any hesitation because you know you're not going to get sick.
Right.
So a lot of times we're behind the scenes.
Can someone recommend or request that a restaurant be inspected earlier than usual because of anything?
I don't believe so, but there is a form on our website if you have a complaint related to food service that you can fill out and they can do a follow-up.
That's great. That's great.
Another thing people might not know that they do is septic and on-site sewage inspections.
Oh, okay.
Okay, so not a fun job.
No.
But if you're building a new home and you need to put in a septic system, they can come out and inspect for that and issue permits for that.
Okay.
So again, kind of behind the scenes, but necessary. And then some of the more visible programs are our outreach services. So that's programs like our HANDS program, which is for new parents. And that expanded a little bit back before the pandemic, and it's not just first-time parents, it's any new parents.
Oh, great. Okay.
So if dad's the new parent in the family, they can qualify.
And what does that mean? What kind of service do they get here?
So it's building parenting skills, looking at home safety, teaching them, and this one goes up to age 2. So we try to get mom while she's pregnant and then follow the baby up to age 2. Because at 3 they can go into preschool. So they survey the home environment. They're teaching them parenting skills. They show them how to interact appropriately for each age of development, or what is appropriate development. And it just gives somebody that you can talk to for a lot of those parents, especially if they're not out in the workforce and I'm home with that baby every single day. Just having somebody come in and talk to me and walk me through the hard stuff. Our HANDS families are usually very happy with the program.
Now, do they have to come to you, or do individuals come to the teachers?
So we got permission to do it virtually during the pandemic, so we still have that aspect a little bit, but typically the home visitor comes to them. So that's another benefit too. I don't have to pack baby out. They're going to come to me to my home. So.
And they're not going to be inspecting and shutting my home down.
No, we're not like Child Protective Services, and some people get that confused.
Right.
Now, if they saw abuse, of course they would have to report it, but that is not why they're there at all.
Right.
They're helpers.
How do you promote that? Because that seems something I didn't know as much about.
And there is a misconception that that one is income-based, and it's not. It's for any family. We just say their slogan is kind of an extra set of hands because it's the HANDS program. Yeah, any family that would like that little bit of help can apply, and you can apply for someone. So if you had a daughter you thought would benefit from the program, you can register them. And it's very easy on our website. Our HANDS program has its own section on our website.
Okay, well, that's great. That is really great.
They're kind of in the same program area, but two separate programs. Our maternal child health program, they focus more on the mom. So more on mom's health, everything from that pregnancy test on into any other health care that she might need, making that connection for her.
So that healthy pregnancy type.
Correct.
And emotions, I'm assuming, too.
And I forgot to say that. We are going to be bringing pregnancy testing back in our clinics.
Oh, good.
So that's something that will directly refer to our maternal child health program to help that mama on through the next steps.
Wonderful.
Our harm reduction program is really rocking and rolling right now. They have
Let's talk about what harm reduction is first.
Harm reduction, a lot of things are harm reduction. When I wear a seatbelt, that's harm reduction.
Oh, okay.
It's just doing things in a safer way. Most of ours is focused on substance use. So we want to start all the way from kids not initiating to people who are in active substance use looking to recover. So we try to span that whole spectrum. So for that reason, we have a school team who goes in and works with the youth, that whole youth initiation thing. We have peer support for folks who are in active addiction, looking for a little bit of help from somebody who's been there. And then we have an actual harm reduction manager who is more on the treatment end of things. So that whole spectrum of care.
Does it include those students? And again, I'm thinking, when I think of harm reduction, those things such as young people that might cut themselves or burn themselves or do things that are harmful to them.
Another aspect of that is our Safe Communities team.
Okay.
Youth suicide is one of their big missions.
Right.
Mental health is also one of their missions. So, like I said, we're trying to get that holistic approach in harm reduction so we can start from the teenager who may be experimenting all the way to the person who's been through a recovery program and trying to maintain.
That's awesome. I was going to say, definitely the mental aspect that's probably where we've all laxed a little bit, in terms of recognizing it and then seeing the need and then knowing what to do in terms of treating it.
And I think that really came to a head during the pandemic. People were more willing to talk about it, and that's a good thing because you can't get help until you're willing to talk about it. So that is one good thing that came out of the pandemic is our willingness to talk about mental health issues.
Right. That is amazing. Are those free, those types of services?
Yes.
In terms of the
yes.
intervention and such?
Now, if they were to go into a treatment facility, that would be billed to their insurance, that sort of thing. But most of our programs, like I said, are for those who don't have insurance or don't have insurance that cover that particular service.
Now, in regards to locations for where are those located in the different counties? I'm assuming they're all in a centrally located area of that county.
Yes, in Hardin County, we have our administrative office, that's on New Glendale Road, and then the actual clinic is on Westport Road.
Now, you're not telling people to go to the administrative business, are you?
No. You shouldn't ever need to go to our office, which is the office I work out of. We're definitely the behind-the-scenes folks. But if you do need the clinical service, it's there on Westport Road. We always tell folks, if you know where the Social Security office is, we're right across the street.
Okay, awesome.
And then another thing you had asked to talk about today was the little respiratory virus illness
Yes.
update, since we're right in the middle of that season. So I did bring a few updates on that for you. Starting with flu. Unfortunately, our vaccination rates are only about half what they've been for the past 2 years.
It's almost like we have to I'm not to say educate as much as promote that you need to get that flu shot.
Yeah, I'm not sure. I don't have a good reason for the why, but if you look at the past 2 flu seasons, it's literally 50% less people have
Wow.
gotten their flu vaccines.
And if they get that, and especially someone that has breathing issues, health issues that deal with lung capacity or allergies and things along that line, it just compromises them even more when they get the flu.
And all of these respiratory viruses, the vaccine is not going to prevent you from getting the disease.
Right.
What its job is to make your disease much less severe, to keep you out of the hospital if you were to get one of these viruses. And we are starting to see an increase in flu-like activity, which is kind of how they measure that. So that's kind of trending up. And then as far as COVID vaccine, as a state, we've had about 260,000 doses administered this fall.
Well, that's great.
So that's not bad.
Right.
And the highest percentage of those who've been vaccinated is in our senior adult population, our 65 plus. So that's a good thing because a lot of times they're the ones most at risk from severe disease. And then you mentioned earlier RSV.
Definitely.
And we are seeing an increase in emergency room visits and hospitalizations in kids with RSV.
And is that contagious, or is it more within the child?
It is contagious. It is a virus. Adults can get it. It's more severe for very young children and older adults. And because it's your immune system's not as strong in both those populations.
Right.
So one thing people can do, one of the big pushes right now is for pregnant women to get the vaccine because that does give her baby some protection after it's born.
That's great.
So that's one thing we can do. And the state has developed, I'm sure everybody remembers all the COVID handouts, the 10, 10, 10, the 5, 10. Well, they've done that for respiratory virus season, and they call it their top 5. It's your top 5 things you can do to help protect yourself. So it's stuff you've heard all through the pandemic, but it works. It makes sense. So number 1, stay up to date on your vaccines, whatever vaccines you qualify for. Number 2 is if you're sick, stay home. So that means don't go to school, don't go to work, don't spread anything to other people. The third one's wash your hands often. Okay, see, common sense stuff. The 4 is cover your coughs and sneezes. It's something we always need a gentle reminder of. I love during Halloween when they called it the coffin cough or the vampire cough, where they would teach them to cough in their elbow. And then the 5th one is, if it's appropriate, wear a mask out in public.
Right. And those are simple things to do. It's not something that is hard to do or you can't do. Everyone can do those things.
Absolutely.
You have a new app.
We do.
Okay. Tell us about the app and how do we download it?
That has been a labor of love. When our director says, "Hey, can you?" I'm always gritting my teeth. But it became available about mid-November. Just Google Lincoln Trail Health Department, and it'll take you to the app. It's available on the App Store and in Google Play. I think it will be really helpful, especially for existing clients, but even for people who are not our clients, because you can get what's happening, in health news. I'm able to push out notifications if we have closures, severe weather, anything like that, any health or safety related thing. I can push that out, in real time. It links to our social media. You don't have to follow us to have access to it. You can get it directly through the app. A lot of the forms that people need from the health department, you can get to right from the app. So I think it's going to be a really useful tool for folks.
I think that's a great way. And again, you got to meet them where they're at, and apps are something that many people feel very comfortable.
And that was the thing. They're the younger people, and I guess that would be 30 and younger at this point, are probably not going to go to the website to get their information. But if it's already in their hand and they're looking for something else, and all I've got to do is push a button and I'm there, it was a no-brainer. So we're really excited about it.
You had your new mascot. How did the new mascot get welcomed about in all these festivals and such?
We love Lincoln. I call him my my fourth child. He actually made his Christmas debut at Christmas in the Park. So if you haven't been to Christmas in the Park yet, you should really keep an eye out for Lincoln. He's out there in lights.
Oh, that is awesome. I want to go back to the environmental aspect of what the health department oversees, and we talked about food, but what about, let's go there, and as soon as I say bed bugs, people will start scratching. But bed bugs, traveling, all the dust mites, those things that can be problematic this time of year, and how your office kind of looks into those things that need to be investigated.
So there is also a form on the website. It's a nuisance complaint. So if there is a facility that you suspect has bed bugs, there are specific things that you can report, but I know bed bugs is one of them. You can file that nuisance complaint, and they can follow up with that.
Is there any infestations that are hot or on the rise right now that you all are looking into or keeping on your radar?
Yeah, not that I'm aware of, but I always encourage folks to be a smart traveler.
That's what I was guessing.
Don't put your suitcase on the floor. Always, check the mattress, look in drawers, because they like to hide, and they come out when you turn those lights off. So
yeah,
do a little spot checking before you settle in.
And in regards to traveling, especially on an airplane when you're really close to people, I mean, is it advisable with people to wear a mask when they're in flight, or just be aware, conscious of yourself?
I would find out the airline's rules. Some of them still require them, so I would, be prepared. And if you're not comfortable being that close to other people, just wear the mask.
No one should have any harm or foul in wearing those. Recently, COVID has kind of come back on the radar. But the protocol and what you're supposed to do, some of those things have kind of changed per organization and such. What are the things that the community needs to know in regards to if you know someone or a loved one that does test positive for COVID, what should you do as a partner in that relationship or a person within that community?
So if you think you've been exposed, the recommendation now is to watch for symptoms. So if you feel like you're having any symptoms, test. And testing is so much easier now. There's so many versions of at-home tests. And I think you can even still order the free tests from the government. Recommendation is if you've been exposed, wear a mask for 5 days, but watch for the 10 days.
Right. And hopefully if they've had that booster, those symptoms will be milder if it is
Absolutely.
COVID. I know that at our schools can also test for that, our nurses on location and such. This
Yes.
is the winter, so what are best practices when it comes to the winter?
Dress for the weather.
Frostbite also.
Yeah. Right now, our weather is really strange. We go from 70 to 40 and back again, so, pay attention to the temperatures, dress appropriately, especially your littles. It's hard when I see littles with nothing on their feet and on their heads when it's this cold. So, yeah, just pay attention and dress appropriately.
Anything else that you'd like to mention that we haven't touched on today?
So one other kind of exciting thing that we've got going on is our Narcan boxes.
Wonderful.
And Narcan is a medication that can reverse an opioid overdose. And they have been placed at all of our health centers. And we have some community partners who are placing them out in the community as well. Here in Hardin County, we have one at Warm Blessings. And we're working with some other community partners to get those out. So people can just come, get one of the kits that's got 2 doses of Narcan, a rescue mask for CPR, and it's got some education in there, and some resources for treatment. So the user can get it, family member can get it to have on hand, whoever thinks that they need it. It's not monitored. Nobody's going to take your name, your contact information. Just come and get what you need.
Right, and it doesn't hurt if it's not an opioid overdose and you use that product.
Absolutely.
It doesn't harm, basically no harm, no foul.
Absolutely. If it's not an opioid overdose, it's not going to hurt the person.
Right, but you've got that on hand. So again, that's free and available at the various health departments. And your hours of open for business?
8 to 4:30, Monday to Friday.
Awesome. And also check out their website. So, Melissa, thank you so much for coming in today.
You're welcome.
And sharing some great information, especially during this time, holiday, wintry weather, and COVID seasons are all hitting at the highest mark. So we appreciate what the health department staff does for our community. Also, look into the app, to download the app on your phone, and check out the various services. And if you know of someone that would receive benefits from those types of services, please recommend them. So thank you again, Melissa.
Thank you for having us.
Okay. And that's it for this edition of EC3 HOSA Medical Moments.